My last question is about the education piece. We're talking about educating a large group of people. We've already decided if it's a non-emergency, they don't get coverage for that. In spite of the fact that we don't have doctors in every village in the state. And there may be an emergency room or there may not be. We have decided as a state that we're not going to cover those costs when that may be the only provider in the area. That's what we've done, right?
Well, most places that have an emergency room have physicians in the community, but your issue on access is an important one. This is why in the patient-centered medical home, we're requiring 24/7 access, verbal access, and next-day appointments to try to keep people out of the emergency room. It's not that we do not cover non-emergency services, it's that we don't cover them in the emergency room, which is the most expensive, least effective place for non-emergency services. So I think with our different strategies, we're trying to have people be able to gain access. And in fact, in the evaluation that is required by the federal government of the state for the waiver, access is one of the first issues that we have to prove that we improved on, as well as in the clinical outcomes and the cost effectiveness of the program. So I share your concerns. This is an experiment. That's why it's a demonstration waiver from the federal government, and that's why there's an evaluation plan tied to it. And we're going to have to look at different regions of the state because access is different. Pursuant to the earlier conversations about non-emergency transportation, access is different in different parts of the state. We have bigger problems in some areas than others.
Access to education is different also in various parts of the state. And while you're educating, or your goal is to educate individuals, and I would hope it would be the greatest of the underserved, are you anticipating a diversity of methods to deliver that education? Because some people tell us immediately, just go to the website. And we don't have web access, as we know now through the education adequacy studies that are going on, even for some of our schools. What is the plan, or has the plan been promulgated on how we will educate people who don't have access, first of all, to the internet, may not have access to doctors who would have the time? Because in many small towns, it may be that one physician, and your waiting time may be as much as 4 or 5 hours just to get in to see the doctor. So how do you anticipate physicians entering into the education piece? I guess I'm from real world.
No, I'm out there some in the real world with you. I mean, of the newly enrolled, and this is, I think, true for the private option as well as the tax subsidized individuals, we have a large number of people who have historically never had the benefit of being able to access the healthcare system anywhere other than the emergency room. And they're confused about where to go. They're confused about how to engage. How do I find a primary care provider? We're trying to use every aspect that we have. For example, on the carrier's provider list, we're putting an asterisk now by the patient-centered medical homes and trying to educate, saying, well, you see an asterisk? You have a phone number that you can call and get a live person 24/7. Where you don't see an asterisk, and you call it, you're going to get the report that says if it's an emergency, go to the emergency room. So this is how we're trying to change the system. We need to work with the legislative bodies as well as the educational institutions on how do we best educate. We don't have that plan completely worked out yet.
Well, when is this supposed to go into effect? Or is it now?
By your direction is February 1st.
So between June and February 1st, we will have ironed out all the kinks concerning how we will educate, how we will do our carrot and stick routine, how we will tell people or encourage people who have lived so far without health insurance at all, well, you know, if you don't put some more of your money over there, you may not get this service. These folks have lived without the service all along.
I will guarantee you that between now and February 1st, we will not have ironed out all the kinks.
Well, let's hope kink iron some of it, okay?
If we identify them and we can ask for your help in solving them, we'll be well done with that.
Thank you very much. Thank you, Mr. Chair.
Senator Chesterfield.